Bismillahirrahmanirrahim. Welcome all on this Zoom meeting today. We are discussing the important issue of mental health in the children. As you're aware of, the mental health issues are ever increasing, particularly obviously we noted a trend in the adult population that it is increasing, but similar trend we have seen in the children. And today we are lucky that we have Dr. Muhammad Iqbal Naeem with us, who will give us a talk and guide us and explain a bit more in detail about these problems. This is basically to raise awareness about these mental health issues. Dr. Iqbal Naeem is the consultant psychiatrist, and he's a senior lecturer at the University of Manchester. He has extensive experience in general psychiatry and also with special interest in the addictive behavior and also dealing with psychiatric disorders and complex issues, including addiction psychiatry. And his research is on dual diagnosis with psychiatric disorders, deliberate self-harm, and suicidal behavior. So without any delay, I will ask Dr. Iqbal Naeem to tell us a bit more about these mental health issues in the children. Thank you. It's all to you.
Thank you. Thank you very much, Dr. Tariq. And I'm really, it's a pleasure and a privilege to be on the platform of Three Memes. And thank you for your kind introduction. I may start my slides and talk. And I think during the talk, if somebody has any question, they can kindly send a text through Zoom. And we can have a few minutes at the end, definitely, for interactive conversation. I would be pleased. Thank you. If I can close my okay. Right. So I hope is my voice is okay, Dr. Tariq? Can you hear me okay? The slides are all right, I guess.
Yes, we can hear you and your slides are okay.
Okay, right. So, ladies and gentlemen, Assalamu alaikum and very good evening. Thank you very much for being with us tonight. And as Dr. Tariq has kindly reminded us, this is a very important topic. And you know, WHO slogan, no health without mental health. And it is in a way fortunate or unfortunate, we cannot ignore our younger generation. Children and adolescents, and it is more challenging between the young adults when they are at the crossing or at the boundary of leaving childhood over to adulthood. So, keeping in mind the limitations of the time, we would try to touch the topic. But if there are anything left which we cannot cover today, we can always come back. So, as the slide indicates, childhood depression, anxiety, and associated risk. So sometimes it is difficult to separate depression and anxiety. Sometimes they are quite intertwined with each other. So today I will focus mainly on depression and risks at the end, and then some where to get help. So it is, keep in mind, it's a generic topic. And if you generate any question, please do not put any personal details or any specific identifiable, because it is generic. If you need any personal advice, you can get in touch with Three Meme later on. We will be able to help you, but generally, for the sake of confidentiality, don't get any specific issue with identifiable details. You may bring an example. Okay. So thank you very much. So everywhere, depression in children and young people. So when I say young people, mean usually, you know, the cutoff line for children to adult in NHS, we all know, the doctors, that it is 16, from 16 onward. However, legally and from social services point of view, 18. Until 18, it is considered as a child. But the health services are, you know, this has become difficult from 16 or 18 anyway. So for a health point of view, if you need anybody, any child who is still a child between the age of 16 and 18, you can contact the adult services. We will come back to this later. So first of all, though depression, it does not only affect adults. The children and young people can depress too. This is need to be kept in mind. And it is important to get help early. If you think your child may be depressed, so as early as possible. Do not delay, do not postpone that. The longer it goes on, the more likely it is to disrupt. The child life can be more disrupted. There are more complications with this. Okay. So how do you know then? Because it is a little bit different from adults. Because when we are adult, we can go to GP, we say, oh, doctor, I'm not feeling very well, I'm not in my usual spirits, I don't have interest, etc. We can identify symptoms. But for the young people or the children, it might be difficult. So you need to not ignore sometime if you see the child showing sadness or low mood, that do not go away, right? It's not about minor, the siblings have a little bit of problem, they might look a bit low or sometimes bored, but a persistent low mood which goes for days and days, okay, 3-4 days persistently going into normal routine, but you see that they're not going to show a smile, they're very disinterested, being quite irritable, grumpy all the time. The nice natured child becomes very irritable or small things. Mother asks about the food or some common things, and the child gets very, very upset or very irritable. So you don't understand what is going on. So the need is just, you don't have to get upset. Just try to identify the person who is going through, or he or she may be going through some difficult time. Not being interested in things they used to enjoy. They're not sitting with the friends. They're not going on to the sports or gym. The young adults, adolescents. So these things, and they start feeling tired. Only small thing. You give them a task. The young person, maybe they do loads of work. I mean, if they just only ironing one shirt, they get tired, or they're reading 2 pages in the book and they couldn't complete their homework. So these are the things which indicate that there is something is not right. So these are common symptoms. And then continue with this, you will see that if they have trouble sleeping, more sleep or less than usual, or they cannot leave the bed, can be both ways. They cannot concentrate properly. You ask them one thing, they don't understand. You have to repeat your conversation or the question to ask one thing. You see, sometimes they look as they're kind of lost in the space, in their own world. They may be indecisive. You ask them, what would you like in breakfast? So you're out on a meals, and they take ages to decide on something. Very simple question, that what would you like? So they cannot decide. Or other things like clothes, etc., and their homework. And they seem to have not much confidence. Like they try to ask so much reassurance whether I've done it right or not. So you can compare their usual self. If there is these changes, just don't ignore them. These are the signs of depression. Similarly, their appetite can be less. They may not be interested in food, right? Feeling hungry, morning, I'm not hungry, mom, I'm just going to bed without eating anything. On the other hand, some children might show like they're eating more, they're going to fridge all the time, or chocolate box. It's called comfort eating, that it's just trying to compensate their feelings. So that can also be. And they can have significant weight change according to their food intake, accordingly, eating less, maybe losing weight, eating more, they're putting on weight with other complications. So now, so if you think these are the situations, and I just add with the previous slide, sometimes children, if you just allow me, sorry. Yeah. So in this, there is sorry, I got a little bit low. Big change in weight. Yeah. So sometime you will see children, the young children, like in a primary school, they may start showing some symptoms, physical, like tummy ache, or maybe school refusal. The moment this starts, the time in the morning for school, they start having tummy ache or headache. So these are the things, they not deliberately do this, but they might be emotionally distressed. So these things, again, don't push them, don't pressurize, but try to understand. That's what I was going to say. Okay. So now you have to identify why children feel depressed. So there are a number of factors. Actually, it is very complicated in a sense, but for the sake of just summarizing them, there are a number of things which can increase. Is not every child who has a family difficulties are depressed, but we can see those are the risk factors. So some people may be very resilient, like any other physical illness or anything, a mental illness. Some people might have good coping strategies. So family difficulties, bullying is very hidden kind of problems. Most of the time, children cannot speak with the parents. And nowadays, mind you, it is my or Dr. Tariq's time, school time are different. Nowadays, this bullying does not stop. Even child leaves the school to come back home, it is on social media. And it is the worst form of bullying. So this can be very, very dangerous. And can lead to a big risk. In old days, as I said, bullying would just you leave the school premises. If there is any bullying, it would leave behind in the closed doors and you come back home. Nowadays, it goes round and round and round. And there's physical, emotional abuse, physical abuse, sexual abuse. We have to actually put the facts, because these things do happen. So if a small child, you need to look at the reasons within the nuclear family. Is there any abuse, emotional abuse, physical, psychological? Is there a neglect, emotional neglect sometime? So lack of warmth, these sort of things are risk factors. Or, sometimes you prefer one child, one sibling or the other. So the other might be feeling left out. These sort of things are all part of abuse. Now, family history, if there is a family history of depression in grandparents, uncles, aunts, so that is a risk factor. Other mental health problems in the family, it may not be depression, but other psychological problems, they can also be risk factors. And sometimes it happens that depression is triggered by any one significant event, like a migration, it could be, or coming to this country, parent separation, bereavement with the family, some relative, some parent, God forbid, any close relative or a friend, they're passing away, can trigger. A problem with the school, different nature. School is more important. Child's life, more than half of the life is spent there. So those difficulties. But in the real sense, when we see in a clinical situation, we see there are usually more than one factor in function, causing mixture of feelings. For example, a child may be having tendency for depression. There might be a family history, right? They may be doing well, but they cannot cope with small stress, i.e. sometimes even changing a favorite teacher in the school, sometimes their close friend or best friend leaving school for something. So these sort of small things can also contribute when two things get together, two or three. So if you think the child is depressed, so what parents will do? So I would say it is very important to talk. It's always, communication is one of the basic, fundamental, and most important strategies. So even before that, but even you identify that, very calm, quiet approach, sit with the child who maybe you think depressed. Important to talk to them. Try to find out what's trouble and how they are going to feel about it and what is going around. And it is very important that you give them a sympathetic ear. That try to something, tell you something. Don't simply dismiss it. Oh, come on, leave it. These things are, no, you be a brave boy. Like boy, for example, oh, share bacha. So no, just try to listen it very carefully. Take it seriously. What is causing the problem? Take it seriously, right? Even a small thing, it might look silly to you, but it is which is a matter. It is important for the child who is suffering. They may not be able to phrase it properly. It may not seem like a big deal to you, but it could be major problem for the child, for their life. If child does not want to talk to you, then do not push. Let them know you are concerned about them and you are there if they need you, right? And encourage them to talk to someone else if they trust. For example, it could be a good friend, could be their favorite or popular family member like uncle, aunt, or sibling, or cousin who they can speak to, or a friend, or someone at school they can speak to sometime. So there will be somebody. So just don't push. And even if there is nothing, then next time, next day, third day, so then it is, yeah, as you said, the term ice melts. So then if you give them reassurance, they may not be. And it is again, when I earlier remember talking about the symptom of lack of confidence. And then they might be finding it very difficult. Oh, I don't know whether I'll say something right or wrong. Might be feeling guilty about. So just try to bear with them, right? So this is being a parent you can do. Okay. So also it may be helpful for you to talk to other people who know your child. That's, sometimes you speak to the school teacher, sometimes the teacher in the mosque, who may have a different view. They see the child from a different angle, and they may be helpful in that situation. And school, as I said, school teacher, school nurse. So these, the main thing is just never to take it lightly. So always do not ignore, act as early as possible. Now, the worst form of depression, I know we have been very quick, but we will, I hope we'll cover the rest of the things in question answer. Now, deliberate self-harm, this is one of the big risks with depression, right? Which we see very commonly. It was probably not so big problem, but now the culture we're living in, the time we're living in, we see this clinically and in the community.
Jav, let me call you back in a few minutes, yeah? I'm on a Zoom call. Jav?
Right. So I muted the brother. Okay, so right. So this is, as I said, it is these days we see very, it is in the culture. Plus, everybody is linked through the social media. Children, everybody is part of one big global village, and these things are actually going. One thing in keep in mind, I personally put it is deliberate self-harm. Normally in UK we call the term self-harm. People are self-harming. So this is non-accidental, right? The young people can hide it for a while, that doing this harm on hidden, like the people, areas of the body were covered with clothes, so may not be identified for a while. But we're just first of all going into why people in the first place they have to do these self-harm. In the form it is a punishing, it is punitive, so it is not easy somebody to take that action, right? So some of the reasons that people may self-harm include that they try to express and try to cope with the emotional distress. Somebody is highly stressed, they cannot talk to, again, we see communication, how important. If there is a barrier, either due to lack of communication or the nature of the event, the stressors, that you cannot ignore that. And then those people may resort to self-harm. They're sometimes try to feel in control, that they cannot do anything about the other thing, but at least they have the control on their body. Although it is very difficult, very painful, but it may not be as painful as their emotional pain, psychological pain, to try to cope with that. And sometimes they have the way to punish them for something. They might be in their mind feeling guilty about something, or maybe somebody else's fault. It's young mind, still young mind, developing. So they might be feeling something, maybe others' fault. They might feel them guilty. So this punishing themselves. Sometimes unbearable tension, as I said, unbearable tension. It might be the same for example, the same thing for other children or them. They might not be able to cope. Sometimes a specific unusual incidents can cause this stress. And then again, there is sometimes it is a response to impulsive or intrusive thoughts. Sometimes the thoughts children cannot control. Those thoughts can urge, make them do these acts of self-harm. And the reasons why they cause this, they may keep changing, because if somebody once in that, any type of stress, and sometimes the one cause or the other, then they can resort to it. It's become a coping strategy in a way, because sometimes we think we're bored, we go and we speak to a friend, we are bored, we can have, let's say, a cup of tea with the family or go out for meals. So this sort of coping strategy, the young person, sometimes they adopt it as a coping strategy. And sometimes it can also become an addictive behavior. They get so much addictive to this doing that without any stress, they continue. We see people in the clinic sometimes, adolescents, they say, oh, well, doing it every night. But the things are going, but so this is sometimes can take this kind of form of affairs. Now, what are the common causes of emotional distress? Remember in the first line, I said emotional distress, children, young people trying to cope with their emotional distress. So what causes emotional distress? So we realize, I think it is not unusual to identify that self-harm is most often described as a way of express to cope with emotional distress. And many possible causes of emotional distress, and then it built up smaller causes and will lead to a bigger one. Bullying is lethal weapon, I would say, because we have known through the press, known through a clinical, because sometimes it can go hidden and only we realize at the end. And this can, some people try to cope for a while with this. This can lead to self-harm. So pressure at schoolwork, sometimes I wouldn't hesitate to say sometimes unrealistic expectations from the parents, which can happen in some cultures in our society. Some households are very, very particular. They want their children, they won't be happy. They say, oh, why, if you have A, why don't A star? This sort of an attitude, this child, it's very difficult for a child to cope with this. And then if there is already going some arguments in the family, some relationship problems, difficulties, financial worries with the family, right? Low self-esteem, whether person themselves or within the family, that can lead to, or as I said, if even parents are preferring one sibling over the other, then the other one feels very difficult. You never know how they're coping. If they say, oh, I'm not getting equal, it may be a different gender, different age of the child, so they may be feeling left over, and you don't know how stressful or distressing it could be for them to cope at times. And then struggling with as we said before, if the person is already depression or anxiety or any ongoing condition, psychiatric condition, mental health issue, or maybe physical health, sometimes disabilities. So those things, they are struggling to cope with that. So these could be also one of the causes. So continue with the causes. So nowadays, this is something very new. Unfortunately, this is getting into school curriculum as well. And I've seen people, some of the friends who children feel very distressed about when the school sex education now, including the different, I would say the different, how to expect the relationship, how to look at the gender issues, and they cause confusion in the youngster, the children. They confuse them about what would they say, because when it is said that it is okay, when the society condones, so this may be okay for somebody, but it is very common people to get very confused about their gender identity. Then bereavement issues, like losing, it could be loss like in the form of a death of a close relative or friend, or it could be in the form of, as I said, some best friend leaving the school, in the form of a separation, when they say, oh, I'm not going to see that person, they have moved with the parents on such place. So these sort of things, or their class teacher changes, so sometimes their favorite toy, which is shared by somebody else, or gets destroyed, for example. If it, like, look at an international perspective, other societies as well, we are privileged in this country, UK, but in other countries, see, bereavement generally is kind of so prevalent, the loss of their belongings. Just in 45 seconds, they say in Turkey, people who are homeowners, they become homeless. You know how much they lost. So it's one of the example. Again, the abuse issues, they may be part of this very significant part if there is abuse, and the very sensitive area. But it is always important that sexual abuse is very difficult for the child to mention to somebody, unless you have very close, a warm relationship, being a parent. And then youngsters, adolescents, when there is any issues of maybe behavior or anything which can warrant their involvement with criminal justice system, involvement with police, that could be due to their behavior, due to drugs, due to being in the wrong company, just especially the adolescents, the people on late teens. So this can be very safe, and then they can lead into other problems intertwined. As I said, one problem cannot go alone. Maybe addiction issue, self-harm, there is sexual identity problems, the relationship difficulties. So they can lead into not the last but not the least is mental health difficulties. The adolescents, like adults, the people who are going through other mental health, like they're already having a pre-established diagnosis of a mental health, psychosis, depression, personality disorder, addiction. So this becomes a very significant cause for deliberate self-harm. Now, turning on to the next is the suicide. It's a very extreme, very sensitive topic, but we tonight we have to discuss this as well. So it is self-harm and suicide. Although self-harm, not everybody who self-harm actually want to end their life. Although there is a clear evidence, it is research said there is clear evidence which is there is a link between self-harm and suicide. But not everybody who self-harms, they want to end their life. Some people describe their self-harm as a way of staying alive by responding to or coping with severe emotional distress. So it is something, as you said, they don't have, although it is unhealthy, but it is just there, a safety valve. They say otherwise their life becomes so difficult that they continue to go this kind of habit or practice, or they try to do self-harm in order to that. And it's important finding that right support or treatment for these people and their underlying causes for this. Because this in the previous slide, the causes for self-harm. So during this, when we try to help these people, understand, identify, and also For example, is a person who has already an established diagnosis, so can contact their already in if the team is involved, like mental health team, or they're known to GP surgery, you always contact the doctor. And the other reasons which have like different aspects, different kind of forms, you might need to be more vigilant, you might be more kind of attentive to children's need, their distress, their movements, what is right, what is going unusual now, so not to ignoring them. Dr. Tariq, is it okay that we address, I think there might be some, so we can put all the questions at the end.
Yes, inshallah, we'll do at the end.
Okay, so now I think this is, before we finally conclude, I must say that we've discussed, but when to get medical help, this is important, right? And I give you a few details which will maybe you can later also revise, or maybe you can signpost. So if you think you need some medical help and child is depressed and you are concerned about their general well-being, you can make an appointment with the GP first of all, right? If you think now you got stuck, all the other thing which we have discussed, anything you think now, we talked about, Dr. Naeem said this and this, but we are stuck. So don't get panic. You speak to your GP, okay? Get an appointment, okay? So what happens to the GP? If initially, you know, the practice nurses, they have some resources at the practice. If they cannot help, they may quite often it is that they refer them, the child, to a specialist service. Usually is CAMS, Child and Adolescent Mental Health Service in every locality, whichever area you're living in UK. The GPs know which is their catchment area. It will be linked to them. And you can also, in certain circumstances, I mean, although it is not a big issue being referred by your GP, but directly you can also contact CAM services. And these specialist services, they have a psychiatrist with a team, they have psychologists, they have social services, psychiatric nurses, support workers, occupational therapists, even educational support worker, substance misuse worker. So it's a very, even these are few, it's not like comprehensive list, but there's still more according to the needs, where or which aspect of the difficulty the child is going through, they address sometimes usually multifactorial. And in children case, mind you, more so psychological therapies and social support before jumping onto the medication prescription. So we always we're very careful. Is a nice guidelines also say. So you cannot expect straight away. And the medical community or the specialists are mindful. They will not start. Some parents sometimes maybe I think they might have an anxiety. We go to doctor and they will start the medication. No, it's not the case. With the children and young people, always we try psychotherapy, social support, and rest of the thing as first line of treatment, right? So you shouldn't worry at all. So, and if you think there is a, you need some more help without going to GP, before going to GP, so this is a number where is a free helpline for parents. So from Monday to Friday it works. So you can make a note of this number. Is a toll-free number. And then is it a Young Minds website? If you type it like this in your address bar, Young Minds website is a wealth of information over there for your help. And of course, you know, this NHS helpline, you can also call them, right? And now it is specifically young people directly. Young mean, I mean, if really from 15 onward, children are, they're very much kind of adult in their approach. They're very sensible with what they can do. So they can confidentially speak to a trained volunteer on the Samaritans. They can email to them. They have this number for the text. Yeah? Text shout to this number. And under 18 up to, like, again, 16 to 18 or like teenage, they can again call this line is for teenagers, and the previous slide that was for parents. So the children directly can talk to 0800 1111. So yeah, that is the end of our presentation. So we have time and we can address questions, inshallah.
Anyone have any questions they can ask, they can type on to the chat box and we will try to answer.
Yes, thank you, Dr. Tariq. Thank you, Doctor, for your excellent presentation, really. I'm Dr. Khalid Abdoun, one of the consultants in emergency department in North Manchester.
Thank you, Dr. Khalid.
Thank you very much, brother. One question, what we can do for child aneurysms, is it could be a part of child distress or anxiety? Could we consider it? And how gonna we treat it?
Sorry, I couldn't understand the first part of your question.
The child aneurysms who urinate over the night.
Oh, right. Oh, yes. Yeah. It is actually, this is one of the emotional distress. Child who, there are two ways of looking at this. I'm just trying to.
Yes.
Maybe I could stop slide sharing so we'll see each other better.
Yeah, I will.
Yeah, Dr. Tariq, if you can help
Yeah.
us. Right. So, Dr. Khalid, the aneurysms, first of all, the age of the child, we all know that at a certain age, children are toilet trained, right? And sometimes it happens that children get toilet trained, they start going to school, and then after a while, they can get into this problem again, aneurysms. Yeah.
Yes.
And then it is definitely there is some emotional problem. On the other hand, sometimes we see the children has not properly trained initially. Like we keep waiting year 1, 2, 3, gone up to the age of 4 or 5. They're still aneurysms. So then the problem is different. It might be organic because they might not have gained that. So there we call is delayed milestones. So then you look at the other milestone as well. Again, best is to get the child assessed by the specialist, whether there is any learning difficulties or some organic causes for that. But coming to now our today's topic, if you see the child has really got potty trained or toilet trained for so many years, they started school, everything was going well. Now suddenly they start. So there can be number of options or the reasons for that. One, that they are emotionally distressed. This is the way of communication. They only say about what they're going through. They cannot say, but this is the way. Sometimes there is a way of making some agitation. Their demands they cannot say, or they're angry about something. So then it is a regressed behavior. So they can step back, so backward step into their developmental milestones. So again, there is a lot of work from mental health services, the psychologist, the person, they might need some time. You may not know. And in certain situations, even sometimes child may not know. So they don't, remember, they not do it deliberately. Never get angry on the child. That, oh, you're bedwetting or you this and that. So these things are only happening because child cannot cope with certain things on their own in a different way. So that's why they get into that behavior.
Any other question?
Thank you, Doctor.
Welcome.
Please unmute yourself if you have any question and you can ask. I think, Dr. Naeem, your lecture was so good that I think there are not any questions.
But even if you don't have question, I would like some volunteer, maybe, give some comments, because you're from your experience, if not from your family. I think we are living in a society, in a community. It will be helpful. So anybody volunteer about some comments on these issues? We've touched certain causes of distress for children in this age of IT and the addiction to screens and having access to social media, etc., etc.
So here's a question there. What would you define self-harm as? So I think you covered it, but can you briefly tell about it?
Okay, self-harm is, we will describe then when it is entirely person deliberately does it. Sometimes it is planned, that they might be thinking about, they might be buying something to do this. Sometimes it is impulsive. In impulsive, like any sharp, usually when say it is a sharp object, like they make some scratches or cutting the skin, arms or legs. But sometimes it can be also the form of like ingesting something toxic. For example, overdoses, heavy amount of tablets, not on the prescription, or if on prescription, taking the very, very heavy overdose, or ingesting some chemicals or things which are harmful. So mainly it is kind of thing which is deliberately, and they know that it is going to do some harm.
Other question is how to reduce the stress in the children.
Right. This is actually in itself a big, I think we can have a session on it. To reduce the stress, first of all, you need to identify the stress and the causes of stress, right? And don't presume that everything is going well, because sometimes one incident or event can be a player for one person, and it can be a stress for the other one in the same household or the same school. So causes of stress, as I said, like if they are looking at, we touched a few causes, that what can cause distress or stress. So number of causes. So reducing, I say, if the younger children in the primary school or just about the school going age, the best thing is, which you can work on, is preventive, right? And it will act as a treatment as well. So be very open to your children. 2 or 3 things I would say, the rule of thumb: be consistent with your children. Don't keep changing the goalposts. Say if you say something politely, say we rule, for example, in the house, don't keep changing that, because that gives the impression that you are not sure, and the children will not be able to set up their routine. Consistent, but very warm, with a warmth, loving way, and don't ignore hugs and cuddles for the children. So that will improve your communication, then verbal communication eventually. And when verbal communication, that means that initially the unduly stress will be minimized anyway. If there is anything child is feeling stressful for any other reason other than the house, for example, school, it could be siblings, could be playground, or in the masjid, so they will be able to speak to you, they will trust you. So what is good communication with your kids? Giving them warmth through company, through listening to them, giving a hug, and being consistent. If you say something, okay, and then be consistent with that. For example, I think understand if I need to give an example, or understand when you mean consistent with one. You say something, okay, today we have, for example, breakfast. We have every day, we have breakfast at 7:30, so that you can get prepared for school. So sometimes children are ready, and then you say, oh, you have not done things when it is 8 o'clock now. Sometimes you wake them up 6 o'clock, or get up, yesterday we were late. So be consistent with one thing. And if it is hard, something you think, for example, the child's demand of something, they want to buy some very, very expensive toy, or a gadget, and you have to say no until say 2 months, we can't have it. We have other kind of priorities or whatever reason, and then you stick to that, but stick to that in a warm way. They don't perceive it as a punishment or as a punitive action. They know that it's a genuine reason, So these are the general guidance for when you deal with children, and this is to minimize the stress. When stress develops, then again we've discussed in the talk that you sit with them, just try to ask them what is going on. Don't push them. They might speak to you tomorrow, might speak to you day after. If not, then you can approach them through a different, maybe friend, or ask them to speak to a close friend, or let them visit to a very close family member. They might trust in a very nice aunt. They might be a favorable uncle or cousins they would play with. So these sort of things, and you do your best. And even before you go to doctor, if anything you think we are now run out, we are helpless, we need some help, then the medical help, going to GP.
Next question is, how can you get the school to support your child with their mental health difficulties? So some schools are not very supportive. Is there any tip on that?
Yeah, I think I have, it is surprisingly though, I have come across this, although I didn't expect. Some of the schools are very nice system that they have a school nurse, and some teachers are very vigilant. They actually point it out. But if anything happens, if you get stuck and you feel, you always arrange a meeting with the teacher or the head teacher of the school. You can request a meeting, just say that you need, and again, as you should be in a cooperative way. You may not seem like that you are going to interfere with their work. Just say that we're trying to understand, we are a bit concerned about the child. And at the same time, if you're very sure that there is something which is more than simple emotional difficulty, then you can always take time off for the kid and see them with the GP surgery, book a time appointment with the doctor.
The other question is that do you have any connection between the exposure to horror movie, violence, and anxiety?
Definitely. Nowadays, it is even twofold problem. If people, children access these violent movie, horror movie, or sometime I think some games, video games, and when they access on the screens, the screen addiction or exposure to screens like phones and tablets and even computers, the screen itself, they have not positive effect, the charge of neurons. If you are 2, 3 hours, 4 hours continuously staring on the screens, they itself charge your neurons. And watching horror movies, watching violent component in the stuff, it is not that everybody can absorb. Children's initially they enjoy, but it can eventually gradually come into their behavior. They may react in their own strange way, but it is something which definitely makes them more anxious, more nervous, affect their attention, concentration at work.
The other question is, how can you get help if a child gets angry very quickly?
Yes. So again, as the first question somebody asked about stress. So again, angry. So anger, it might be just a symptom. It is not a big problem. You need to see what is actually fueling anger. What is the background? The person, sometimes the child who is distressed, they may express in an anger way, being more frustrated, being more difficult. Sometimes anger could be that they have watched something violent in the film. Sometimes they might have been angry on somebody else out in the school, on a friend, and then express in the house. So it is the anger management is basically at children level. First, you need to understand what is causing it.
There's a question I think we have dealt it before, but I quickly answer here. They're asking how you can get your child diagnosed for ADHD and autism. I think if you look on our YouTube channel, we have covered this topic previously. So I think probably you can get more information about how your child can get diagnosed for ADHD. Any other questions? So yes, we can't give the personal details of Dr. Naeem because I think obviously it's a confidential issues with the children. However, if you have any question, you can message to 3MEM and we see if we can get some help from your question. We will not share his number here. Okay. So any more questions or anything? I think I've covered all I've looked on. Let me see if anyone missed it there. Not anymore. So if there are no more questions, I think probably we can close today's meeting. And I think we will cover the topic of anxiety. I think it's in one period. I think as we understand from Dr. Naeem, it's not possible to cover whole area of the mental health on one. But we have, as we did with ADHD, we done the series of the programs. So inshallah, we'll be, I'm sure Dr. Naeem will give us a bit more time and we will do another program on anxiety and some other issues, inshallah. Dr. Naeem, anything you need to add before we finish it?
No, I think we have talked it a few times, but I think if as a kind of nice gesture, if I say take home message for all the parents, and I presume most of us are here because of our children, keep in mind about good communication, warmth, with the non-judgmental view. Even you see something which is you disapprove, you become non-judgmental for that point of view, but increase your communication with the child, increase your warmth. Only then you will have the child's cooperation so that they can open up with you. And this is the healthiest thing you can do for your child or developing. And this becomes to increase your confidence and mutual trust, make them more confident, make them feel more in control without resorting to some unhealthy things. So good communication, warmth, and consistency. So may Allah help us. And I would say thank you very much for 3MEM and thank you very much for participants to be here with me. And we will be, inshallah, as Brother Dr. Tariq has said, if you just any other topic, we'll bring some more. Now, anxiety is probably the next one. We'll try to find out. We'll talk about anxiety issues.
Inshallah. Inshallah. Thank you, Dr. Naeem, for your time. And inshallah, we will arrange another sort of session. And I thank you for all the participants who came and listened for this program. And thank you from 3MEM. Allah Hafiz.
Thank you. Allah Hafiz.